Hello everybody and welcome to ESC TV. My name is Dominik Linz and I'm here together with two of my friends and colleagues, together with David Schaack and also Valentina Kutyifa. Both of my guests today presented very interesting studies during the late breaker here at EHRA 2026. The ULYSSES study by David and also the LIBRA study by Valentina. So Valentina, what did you find in your study and what actually could you tell us now about this?
Great. The LIBRA study was designed to look at contemporary outcomes of non-ischemic cardiomyopathy patients with a primary prevention ICD or CRTD. And in this particular study, we looked at the effects of novel GDMT, SGLT2 inhibitors, and ARNI. When we looked at the SGLT2 inhibitors, we found a 53% reduction in VT, VF, or DAS, which was primarily driven by a significant reduction in VT or VF. When we looked at the ARNI, patients who were prescribed with an ARNI had a 24% reduction in VT, VF, or DAT. But in this population, the reduction was primarily driven by a reduction in all-cause mortality. And this is the major findings of the trial.
So this was actually the LIBRA study?
Yes.
And now David, the ULYSSES study. So what did you study there and what did you find?
ULYSSES was designed to answer a quite simple question whether ultrasound-guided venous puncture does reduce vascular complications in patients undergoing catheter ablation for atrial fibrillation. And we randomized 986 patients to either ultrasound-guided puncture or conventional palpation-based puncture. And we did actually find a significant difference in vascular injuries, which only occurred in 0.6% in the ultrasound group and 3.3% of all patients in the conventional group.
Okay, and this was actually the ULYSSES study. So actually coming back now, Valentina, to you. When I go now next week in my outpatient clinic and if I find actually patients who would have had the inclusion criteria to your registry, what should I do?
So one of the most remarkable things we found is we looked at the effects of SGLT2 inhibitors and ARNI together. And we actually report a synergistic effect of an even greater reduction in VT, VF, or DAS when you use both drugs combined. So this supports that all of the patients who have an indication for a primary prevention ICD today with non-ischemic cardiomyopathy should be prescribed with both medications, preferably before the implantation of the device, as they have great benefits with reductions in VT, VF, and all-cause mortality.
So the combination is better than one of each of those treatments? Perfect. So good take-home message. Now, David, when I go now to the EP lab next week, what should I do?
That's quite simple. If you already used ultrasound for your punctures, you should be happy that you already implemented the best practice. And if you up to now used conventional palpation-based puncture, you should change that. I think the new standard of care then should be ultrasound.
Yeah, standard of care, ultrasound guided puncture, probably no reason not to use this, right?
Yeah.
Perfect. David, Valentina, thank you very much for joining us here at ESC TV. And just let's enjoy the rest of the conference.
Yes.
Thank you very much.